Hi, welcome to part 1 of your cranial nerve examination. Today's portion of your cranial nerve exam will be exploring your olfactory nerve, your glossopharyngeal nerve, your hypoglossal nerve, your vagus nerve, your trigeminal nerve, facial nerve, and your accessory nerves. So what that means is we will be exploring all of the nerves that interact with your face, facial muscles, nose, mouth, tongue, throat, jaw, and your general sense of touch and sensation. Okay, this exam will be completely painless and should be very relaxing for you. Alright, so to begin, we are going to be testing your olfactory nerve, which is your sense of smell. So, lately, have you experienced any problems with your sense of smell? Anything smelling different, odd, unusual, or complete lack of smell? Good. And this will be very, very easy and very, very simple. All I'm going to ask you to do is simply to close your eyes, occlude one nostril, and take a small smell of what I have in this little bottle here. Okay? So again, close your eyes, occlude a nostril, and take a smell. Take a smell. Good. And what do you smell? Coffee. Very good. We are going to do the same thing again. Close, close those eyes. Occlude one nostril and take a smell. What do you smell? Vanilla. Very good. So, it seems your sense of smell is perfectly intact, which is wonderful. Since we are now testing your sense of smell, we are also going to test your sense of taste. So we are going to first do a brief oral examination, then we are going to test your sense of taste, and then we are going to test your vagus nerve, which is a very, very gentle gag reflex test. And I promise we will be as gentle as possible. Alright, so just sit there for a moment. I have another small vial here, and as you can see, it has a little tip, which will just drip out a little bit of the liquid right onto your tongue. So I want you to close those eyes for me. Stick out your tongue, and I am just going to 1, 2, 3, drop. And what do you taste? Lemon's very good. I'm going to grab another bottle here. Same thing, keep those eyes closed. And stick out your tongue. 1, 2, 3, drop. And what do you taste? Coffee. Wonderful. Go ahead and open your eyes for me. Well, my friend, it looks like your sense of taste and smell are perfectly intact. So now we are going to do a brief oral examination on you. Alright, test that vagus nerve and also take a look at the tongue and that hypoglossal nerve of yours. Alright, so why don't you go ahead and open your mouth for me, and when you do, I'm just going to feel here under your jaw. Just keep that mouth open. Keep it open. Good. Okay, very good. Now, keeping that mouth open, I'm just going to use my light and take a look inside. So, keep the mouth open. Good. Stick out your tongue for me. Just going to grab it and lift it up. looking for any spots, lesions, lumps, bumps, things that should not be there. Good. Good. Just gonna move to the side. Good. To the other side. Good. And good. All right. Well, now we're going to test the vagus nerve. Not everybody's favorite test, and while painless, it may be a little uncomfortable. So I'm just going to grab a tongue depressor here, fresh out of the package. That doesn't want to open very well, but all right. So going to just ask you to open up and say ah for me. And I'm going to grab my light again. So please open, say ah. And I'm just going to insert the tongue depressor, looking at the reaction of the uvula and going back, 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 back. Good. I know, not very comfortable. Swallow for me. Good. No more tongue depressor, I promise. But I would like you to look straight at me. Open that mouth again. Open your mouth. Good. Stick out your tongue. Move to the left, right, up, down. Good. Can you curl your tongue? Like that. Good. Can you do anything else with your tongue? Okay, good. Looks like your mobility and tongue movement is very, very good. So that is a wonderful, 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 wonderful sign. Love to see it. Love to see it. Alrighty. So that will cover your vagus nerve and also the hypoglossal nerve, which means we are going to move on to your trigeminal nerve, facial nerve, and accessory nerve. So for this portion of the exam, I'm going to be having to touch multiple parts of your face, and then we are also going to be doing multiple touch point sensation exam tests on you. All right. So to begin, we are going to do a facial examination. So I am just going to look at your skin, look at your face, just looking, examining different parts. I'm going to come over here. I'm just going to touch your ear. Does it feel any issue when I touch your ear? Okay. Good. And I'm going to come over here. I'm going to touch your other ear. Any pain or discomfort? Any pain or discomfort? Okay, good. Alright, so we're going to just come back up. I'm going to just be touching along your forehead, eyebrows, and right above your eyelids here. So just stay still for me so I can just check you out here. Okay. Just going to gently do a little percussive taps on your forehead. Just let me know if you feel any discomfort. Nothing? Good. I'm going to come over here. I'm going to palpate on your temples. So we're going to good. And then we're going to move down your T-zone here. Just going to apply a little pressure, moving my way down, 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 down. Good. And then we're going to go under your eyes. Just palpating. Good. It's a little windy out today. You can go home after the exam, Curl up in a blanket. Or watch your favorite movie. Read your favorite book. Do all those fun things that we like to do on those blustery, windy, not so nice days, you know? You are doing absolutely fantastic. So we're going to move over to your cheek here, and I'm just going to just inspect, examine, good. Into the other cheek, inspect, examine, inspect and examine, good. Alright, you're doing wonderful. Just going to come a little close, look at your upper lip. Just good. Run down to your chin. God, you're doing wonderful, I promise. Alright, now we're going to check out your jawline. So we're going to come up right under the jaw here. Just feel around. Good. Just going to feel right back behind the jawbone. Just feeling for anything out of order, anything that doesn't feel like it should be there. Have you had any problems swallowing, chewing, anything like that? Good, okay. Go ahead and clench your jaw real tight for me, and I'm just going to palpate back there behind your jaw. Good. Clench your heart again. Good. Feel your throat. Again, feeling here, just making sure everything is where it should be. Not feeling any swelling of your thyroid, which is good. Feeling any kind of swollen glands, no cysts, nothing. So that's what we want to see. And then come back up to the jaw. Gonna feel for those lymph nodes. Just stay still. Good. Feel this one real close, real quick. Okay, that's fine. You're doing wonderful. Alright, so let's test out those facial muscles, shall we? I want you to sit back, sit up, look right at me, and I want you to give me a big old smile. Good, now big old frown. Good, now puff out your cheeks. Like that, keep them puffed, and I'm just going to try to pop the puffy cheeks. Good, do it one more time. And we're going to try to pop the puffy cheeks. Don't let me pop them. Good. Wonderful. That looks good. Alright, so keep your head straight. And I'm going to just put my hand under your chin, top of your head, and I'm going to try to force your head down. Don't let me force it down, okay? Ready? 1, 2, 3. Fight me, fight me, fight me. Good. One more time. 1, 2, 3. Fight me, fight me, fight me. Good. Alright. We're going to do another musculature test. So I'm going to place my hand inside your face. I'm going to try to push you, and you resist. Alright, so here we go. I'm going to try to. Ready? And push. Good. One more time. Push. Wonderful. Other side. And push. Good. Keep resisting and push. Wonderful. Now we're going to test your shoulders. And I'm going to just put my hands on your shoulders. And I want you to try to lift them up while I push them down. Alright. So here we go. And don't let me push them down. Don't let me push them down. Don't let me push them down. Try that one more time. And here we go. Come on. Don't let me push them down. Don't let me push them down. Don't let me push them down. Wonderful. Alright, and we are going to do one more facial test. So I'm just going to push on the top of your head, and you don't let me push you, okay? So just stay still, and I'm going to push. Good, and one more time. Push. Wonderful. Do the same thing, other side, alright? And here we go. Push. Good, and one more more time. Push, push, push. That was awesome. You're doing absolutely fantastic. Acing part 1 of your cranial nerve exam. For the final portion of part 1 of your cranial nerve examination, we are going to be testing your trigeminal nerve. The trigeminal nerve is the nerve that is in charge of your sensation of touch. So during this portion of the examination, I'm going to be asking you to close your eyes, and you may keep them closed for the entirety of the portion of this exam. Okay? So close your eyes, and I will begin the touch point test, which will be touching you at different points on your face and your neck, and you will tell me to differentiate between which object I am touching you with. Alright? So we will start with something very easy. I'm going to touch you with object number 1, which is soft, and object number 2, which is dull. Alright? So you're going to tell me if it's soft or if it's dull. Alright? Okay, so, and good, soft. Good, dull. Soft. Dull. Dull again. Soft. Soft. Dull, very good. Soft again. Dull. Keep those eyes closed. Now we are going to test sharp versus dull. Okay? And dull, good. Sharp, good. Dull, very good. Sharp, good. Dull, good. Sharp, good. Dull. Dull, good. And keep those eyes closed for me. We're going to do a little more detailed exam. So you tell me if you can feel the soft brush or the fuzzy brush, the soft brush or the fuzzy brush. So tell me, soft, good. And what's that? Fuzzy, good. Soft, very good. How about fuzzy, good? How about soft, good? Fuzzy, good. Soft, good. And soft again. Keep those eyes closed. And the final one is going to be cool or warm. Cool or warm. Cool or warm. Alright, keep them closed. And cool, good. Warm, good. Cool, good. Warm, very good. Cool. Warm. Cool, good. Warm. Down here. Cool, good. Warm. Wonderful. Go ahead and open those eyes. Open those eyes. Well, my friend, I have to say that for part 1 of your cranial nerve exam, you passed with flying colors. So I would like you to go home, relax, hydrate, and rest the rest of the day. And we'll see you again for part 2 of your cranial nerve exam soon, okay? Alright. You have a wonderful day. Bye-bye.